On this week's episode, Dr. Mike and I discuss how to treat a pinched nerve. Hi, I'm Brooke, and today I'm with Dr. Mike, and we're going to talk about pinched nerves.
Yep.
Dr. Mike, what's the most common way that people do pinched nerves?
So it's usually either from a combination of whether it be an accident, think about a car accident, or a lifting injury, lifting at work, falling off a ladder, some type of a gross type injury that we see that brings somebody in. The other is just chronic repetitive motions, and so that will start to deteriorate joints, get some arthritis, some inflammation in there. That can lead to the symptoms of what would be a pinched nerve.
And what exactly is a pinched nerve?
So a pinched nerve it can be a nerve anywhere within the spine, but typically where we'll see them would be more so in the base of the neck and then the lower part of the back due to inflammation within the joints. We get those minor misalignments of the joints and then from their normal position, we get some irritation, we get some swelling. That can then cause that nerve pressure to send, whether it's a numbness and tingly feeling, a loss of grip strength. A lot of people say, I was holding my cup of coffee and then, just fell out of my hand, or just a shooting, radiating kind of pain.
Okay, so maybe lifting something improperly could cause a pinched nerve?
Absolutely, yeah. So whether it's, like I said before, like in terms of like a work injury, or you're at the gym and you see some guy doing a deadlift, like, I can do that, and then doing that improperly time and time again.
Yeah.
Tend to see a handful of those here and there, yeah.
So you said a numbness. What else could a pinched nerve feel like? Just like sharp shooting pain?
Sharp shooting pain, it can go anywhere from, it depends on which nerve is irritated, but we can get it anywhere in the upper extremity. If we're talking about a couple of fingers or multiple fingers, just through the upper part of the arm, we can get it that radiates across to the shoulder. In terms of the lower body, we can get a radiation of pain into the groin area, or anywhere down the front, back, side of legs. It gets bad enough and go all the way down to the feet and into the toes as well.
So do you see some people that just deal with the pinched nerve and it's always there, they just don't come and get treated right away?
Not typically.
No.
A lot of people will try that method, just wait and see what happens.
Yeah.
They take some ibuprofen, or they go to their medical doctor and get a muscle relaxer or a pain reliever. It always comes back. Even if it goes away in that initial portion, if you're not doing something to actively correct the problem, which is that misalignment, it's going to come back 99.9% of the time.
And what do we have in the office, I guess, that would help treat that?
Okay, so first and foremost is going to be the adjustment. So realigning those vertebrae within the spine, we're going to restore that motion, we're going to decrease inflammation and swelling, basically stop that from happening. We could also do some muscle work, whether us as the doctors or referring them to one of the massage therapists to work on that. The last thing, it would be spinal decompression or traction would be probably the best way to deal specifically with those nerves other than the adjustment.
Okay, and then after Reenie's Fitbit, you're actually going to put me on the traction table.
Yep.
We're going to go through, I guess, what it can benefit and what it feels like. I know people have said that they just like to get in just because it feels great as well.
Absolutely.
Okay, awesome. So we will see that next. Hi, I'm Rainey. Welcome to the Fitbit of the Week. This week, I want to show you some tips that you can do at home if you're having low back pain. So the first thing I want to show you is just icing. So if you have an ice pack, you'll want to ice the low back to help with inflammation. So what you're going to do is lay back onto the ice pack right at your low back or where you're feeling the pain. And then you're going to want to have your knees bent, or you're going to want to kind of pull them up towards your chest just so your low back is laying flat on the ice pack. It is important to know that you want to ice for a minimum of 10 minutes so that you can at least get some of the effect, but no longer than 20 minutes because it could damage your skin if you're on the ice for too long. The next few things that I'm going to show you are just stretches that you can do at home. They're pretty easy. The first one is just like I was doing with the ice pack, just bringing your knees up towards your chest. You may feel a stretch in the low back. If bringing both knees up is maybe a little painful or a little too much, you can just do one knee at a time. You'll still feel a little bit of a stretch that way. But make sure you're doing both sides a few times. The next one is cat camel. So for this one, it's kind of tricky. You're going to be on your hands and knees. you're going to kind of arch your back upwards to do like the cat motion. So you're kind of like tucking your hips under you, raising your back up, and then you're alternating to camel, where you're going to push your hips back and kind of arch your back downward. So you're feeling that stretch in the low back. And again, you want to alternate it a few times each time or each way. The next one then is to go from your hands and knees, sit back onto your heels, and this one is called child's pose. So you may have seen this in like yoga poses or whatever. But you're just having your hands over your head, sitting back on your heels as best you can, so you can feel the stretch. You might feel it up by your shoulders, but you also feel it down in your low back too. Kind of get a little bit of relief there. The next one is hip flexor stretch. So your hip flexors are located on the front of your hips. And for this one, what you're going to do is be down on one knee. So one knee down, one knee up. Your front foot is far enough in front of you so that when you go to kind of lean your hips forward, your knee still stays above your foot. It's not back this way and my knee isn't going over my toe. That can cause problems to the knee. So you want to make sure that that foot is far enough in front of you, kind of lean forward, and I'm feeling the stretch here on the front of the opposite hip. Again, hold this stretch for a while. You really want to do these stretches for like 30 seconds to a minute, really as long as you can. The longer the better. And you want to do both sides. And then the last stretch, I call this butterfly stretch. So you're going to sit down, you're going to try to put your feet together, and then kind of like take your knees, not pushing your knees down, but just kind of take your knees down yourself towards the ground. So I'm decently flexible. You might not be able to go this far, but you're going to feel the stretch through the insides of your legs, through your adductors. To do that one, again, hold it for as long as you can. So that's all the stretches. They're pretty simple. You can do them at home on your own. And again, I was mentioning to hold it for as long as you can. Also, you want to try to do it a couple times a day. So the more often you do it, the better also, until you can come in to get some care from one of our doctors. But even after you get care, it would be good to continue that routine on your own. But that is all I have for today, so I will see you next time.
We're back with Dr. Mike here and the traction table. He's actually going to get me in it, and we're going to show what a treatment would look like for somebody with a pinched nerve in their neck.
Yes, so with the table we have here, it's actually good for neck as well as lower back type things, and so I'm just going to give her a brief rundown of what to do. So she'll lay up here on your back, and place your neck between these two little goalposts here, and then the back of your head will just sit on this little pad. Good there?
That's good.
All right, so it's basically going to be pulling her from the back side of her skull, and we're going to basically just be tractioning up and down in terms of those neck muscles and those joints there. And so I have it already set, and so it's going to start pulling, and what it's going to do is that's going to pull her up to a maximum weight, relax her back down to a minimum weight, but never take that stretch off of the joints themselves. And so she's always going to feel a little bit of a constant stretch. What I always tell individuals is that it may be a little uncomfortable in the moment, but the benefits of it kind of outweigh that. And so the reason it may be uncomfortable, if the muscles are really flared up, really tight, it's going to be basically stretching against those tight muscles. That can cause a little bit of discomfort. Treatment itself lasts about 10 to 15 minutes depending on the amount of poundage that we're pulling with. And most people just simply relate it just a nice, easy, gentle stretching that they'll tend to feel while in the machine.
All right, so I just did my 10 minutes on the traction table. It felt great on my neck. So if somebody were to come in with a pinched nerve, Dr. Mike, how often would you have them on this from the beginning towards the end of care?
So in the very acute phase, when they first come in as a new patient, or if it's an exacerbation from an existing patient, I myself personally would have them do the traction on every chiropractic visit. So that way, one, we're getting those joints realigned, getting the muscles to relax, but then two, as we do that stretch, we're pulling all that inflammation and swelling off of it. Get a lot of people that we do it with just on every visit, even on their maintenance type visits, just because it feels really good, it keeps their back or their neck, just moving and functioning a whole lot better. So with those guys as well, we'll just keep it on whatever their chiropractic schedule is.
Okay, so a question I forgot to ask in the beginning. I know that I've pinched a nerve. What's the first thing I should do?
First thing you should do, whether you're an existing patient or a new patient, get in for an appointment just so we can check it out, because that way we can rule out, is it a pinched nerve? Is it something potentially a little bit more intense in terms of like a disc bulge or disc herniation? Or if it's something that's not as severe as what a pinched nerve would be, we can then definitely help out with some home care kind of stuff that you may be able to do as well.
Okay, so would icing help?
Icing would be a good start, yeah, just
Okay.
because once again we have that inflammation, we want to decrease that amount of swelling and inflammation.
All right, so that's all we have for this week. Hopefully this episode was helpful. We will see you next time.
To submit a question, watch a past episode, or to find out more about the Springfield Wellness Center, check us out on Facebook, subscribe to our YouTube channel, or find us on Instagram, or check out our show website at wellnesslab.tv.